Today we're going to be talking about something we don't often cover, cancer. We don't cover it enough because we spend so much time on diabetes. And actually, there are some cancers that are very much related to diabetes. But we're going to be talking specifically today about breast cancer, a women's health issue. I highly encourage you, even if you're a man, to watch this video because there's some very strong advice for men in this space on how to deal with breast cancer in your loved ones. And in case you didn't know it, men can get breast cancer too. Cancer is one of the top 3 leading causes of death worldwide. Breast cancer is the second most common type of cancer in women after skin cancer. And it's the second deadliest cancer of all after lung cancer. 1 out of 8 women in the U.S. will develop breast cancer. 1 out of 8. So think about that and think about the odds of that touching you and your family if it hasn't already. Different issues increase the risk, like obesity, elevated insulin, as we just mentioned. But there are times that the risk is there, but it's just hard to see it. You know, we even talked about things like telephones, electromagnetic radiation. Is that real? We talk about that in there. Even things like shift work has been associated with this. So let me introduce our guest for today, Stephanie Weeks. Stephanie has a podcast and she's starting a YouTube channel. She was diagnosed herself with breast cancer. Now that's bad. She was very young for that diagnosis. The biopsy showed it was a very aggressive triple negative cancer. That's going from bad to worse, way worse. She continued to push through this, and you'll see her attitude is incredible. Not only did she survive all of that, then she's gone on to tell her story and has become a model for double mastectomy patients. She's sharing her story with us today, and she goes way deep into what we can do. So, without further jawboning on my part, let's introduce Stephanie. So, as I said, we will pre-record the interview, and then I will turn to you and say, well, Stephanie, we're a prevention channel, as I mentioned in the intro, and your story is so much more than prevention. Obviously, it's a major motivator for those of us who want to prevent. I know in one of your videos you mentioned, but I did everything right. I didn't understand why me. You want to start with that part of the story?
Yes. Well, first, thank you for having me, and I would love to start with that. I had a family history of a lot of issues when it comes to medical. I used to joke and say when they give you the form and you check it off for your dad, it was like, well, just check all the boxes, please, because it was like everything. I mean, he was in a nursing home when he was 50 years old. He passed away when he was around 60 years old. He always had issues. And I saw that, and I saw him dealing with those things. And I just tried to identify, even as a young person, like, what do I see that's might be something to look at here. And he just didn't, he had stress and he wasn't stable in his household at all. He was actually homeless a lot. And of course, that limited his availability to medical care, and that limited his availability to say, I don't want to eat fast food today, right? And I don't want to get food from the convenience store. And I had the same thing or similar things on the other side of the family. So once could start controlling things, I was like 15 years old and we didn't have a lot of money. So I would get I remember I had like a 20-pound weight, and I would do everything I could do with that 20-pound weight because I wanted to have movement. And I wanted to watch what I was eating when I could control it, which that took later years for me to be able to have those choices and those options. But once I became an adult, I ate healthy. I juiced, I watched my nutrition, I got a lot of movement, I exercised. And as I got older and I could afford more things, I started doing colonics and I was doing vitamin drips long before the celebrities even started mentioning that kind of stuff. When I was diagnosed, it was like, wait, what? Because I've done everything right. I will remember this one of the pivotal moments in this journey, sitting in my integrative medicine doctor's office, because she had treated me for many years. So she knew who I was, how I was. I didn't want to just like, okay, here's the answer, but why is the answer? What is, 10 questions deep into that. Sitting there and I said, I've done everything right. I don't understand why I'm here. And she says, Steph, you've been preparing for this your whole life and you didn't even know it. And I still get chills when I say that. I was determined to find the lesson in this. And many, many people told me, oh my gosh, we are screwed, pardon my French, because you're the healthiest person I know. And if it's going to happen to you, then we should eat the hamburger and we should, whatever 10 examples I could give. And I knew that that wasn't the situation here. I just knew that it wasn't. And now, being over 4 years into this journey, I realized two profound things. Number one, chronic stress. I was in chronic stress for over 20 years. And even if I could do everything else right, that stress is going to catch up with you at some point. You've got to be able to monitor your stress and try to control that in any way that we can. And number two, we were sitting there and she says, I was at this conference and there were two doctors from opposite ends of the world who presented with each 15-year-olds that had aggressive breast cancer. This is completely unheard of. And as that's coming out of her mouth, I grab my cell phone and I hold it to my bra where I had been keeping my cell phone constantly for years and years. And my sister would always say, you got to stop doing that. And she would just get on me for it. I put the phone right where it would sit in my sports bra. And that's exactly where the tumor was. And the tumor was actually so close to the skin, it was almost touching. And it was right here. And it was just like, oh my God. It was just, I can't even explain. I can't even explain the feeling.
So you think it was electromagnetic radiation?
I think that we all have cancer cells in our body at any given time. And whether or not that we can, I kind of say shoo like a fly, right? Whether or not we can shoo it away like a fly because our immune system is optimal or not, or is it going to kind of get in, right? Like, how good is your foundation of your house? And for me, I felt like the foundation was pretty good, but the chronic stress had those weeds kind of breaking through and cracking in the foundation. And then pair that with the cell phone and who knows what else, right? But I just found like those were two profound things that were lessons in my journey that I said, I've got to share this with people, because the lesson's not, oh, Stephanie was the healthiest person I know, so let's do whatever we want. That's not the lesson. The lesson is, be careful of where you're putting your cell phone and somehow find a way to manage that chronic stress.
So you bring up a couple of points. One has to do with the fact that we all have cancer cells growing all the time, and it's really something like BRCA, the breast cancer gene that Angelina Jolie had. She elected to have mastectomy, preventive mastectomy, and you did sort of the opposite, which is a major part of your story, which I wanted to get into a little bit later. But before we do, I just want to mention this about my own exposure or my own experience with electromagnetic radiation. I had a patient once. We discussed him before the video, and he was a very, very high level engineer. Actually worked became a vice president for one of the Fortune 10 companies and then a CEO for one of the Fortune 500. Um, Actually, more, I think probably more the Fortune 100, very big company. And he was all into EMF or EMR, electromagnetic radiation. He had his bed set up. He had his house totally renovated, tens of thousands of dollars. And I'm thinking, And he said, "You think I'm crazy, right?" And I said, "Well, I mean, I've seen some stuff on it, but I'm not so sure." But as I often did, I dug a little bit deeper and did a video on it. And there is no question. There's risk there. It's just not one of the things that we think of in the very beginning.
Right. And if you, I'm going to try to remember because I don't have my phone in front of me. If you have an Apple iPhone, I don't know about the others, if you go to settings, you go to general, you go to legal, and it says something else, and you click on there, it tells you the warnings of the EMF, and it tells you to basically not hold your cell phone to your head, among all the other things, right there in your phone. And I found that yesterday, and I was like, I finally have something else to show people that think that I'm crazy when I say that type of stuff. But I just know that it's a contributing factor.
Back to the fact that we all have cancer cells going. Uh, in my genetics class, some genetics work I did at one point in time, we learned that that breast cancer gene is not really a breast cancer gene. It's the problem associated with a gene that's supposed to clean up cancer. Animals have it, we have it. It just happened to be discovered associated with breast cancer. Do you want to tell a little bit about that and what happened with the immunology of your breast cancer?
Yes. So I am positive for the BRCA2 gene. And what that is the genetic mutation of the repair gene that's made to clean up things as the cells are going haywire and, more scientific stuff than that. But that testing came after the diagnosis came. And that paired with a list of other reasons, I actually decided to do, it's called a double mastectomy or a bilateral mastectomy. And when you're in that moment, and hopefully no one has to ever be, but when you're in that moment and you're Googling mastectomy, there are images that are there, and those are valid, real images, okay? But they're not the only images, and they're not the only options. And part of my mission is to educate women on their options, because with the mastectomy and reconstruction that I had, the doctors worked together, the plastic with the surgical oncologist. And while one was doing the mastectomy, where they're literally like kind of like a little graphic, but I mean, I say I was gutted like a fish. So they kind of like, get everything out. And then the plastic would come over and start rebuilding. And they kind of worked in tandem in that way. And I was able to do that at one surgery. It was about a 12-hour surgery. Usually takes 6, they say, but they were able to reconstruct from my body parts. So I never had the concave look. I don't have scars across the front of my breast like you will see, like some women do, and they're all beautiful no matter what we choose. I just want people to know that there's more options, right? So I don't have the scars right across the front. I never was concave. I never was flat. I don't have implants. I did not go through the expander situation. I literally woke up feeling completely whole with actual like full breast. And it just still on a daily basis completely amazes me what they have done. And I just want to be able to spread that word.
That was, I have to tell you, for a minute, it caught me when I saw the video. It's
Mhm.
about as close to graphic as you can get and still stay within YouTube guidelines. It didn't show any
Yeah.
nipple. By the way,
Mhm.
you did not lose your nipples.
Right. I did do a nipple sparing mastectomy, so I did not have to lose the nipples. Now, if there was cancer in that area, then I would have, but there are so many amazing and beautiful options that they can do with tattoos. You cannot tell the difference. It's completely and utterly mind-blowing. And speaking of the graphic photos, my daughter says, "Oh my gosh, mom, like my friends are going to see this." And I'm like, I'm more worried about the women who need to see it than the people who I might not want to, or she might not want to, or my husband might not want to. Um, that's what I'm more worried about, is getting the education out there. And the other running joke, especially when I first, had the surgery done. I mean, I was showing everybody. I was like, "Oh my God, look." And my husband's like, "You've got to stop showing everyone your breasts." And I'm like, "It's not breast, it's stomach. It's not even breast, it's stomach." So it's like fine, It has calmed down a little bit, but it's just completely mind blowing that they can do something. I told them that they're artists, to be able to not even like see anything physically, but in their mind, right? I'm going to take this, I'm going to take that, I'm going to put it here. It just completely, I'm just still in awe.
It's so that's the exact progression I went through when I saw it. I said, "Oh my gosh, people are going to see this." And then I thought, and dang, they need to, because I've talked to
Mhm.
so many people that were just devastated, both husband and wife, by loss of the breast, just disfigurement. And you didn't have that kind of disfigurement at all.
And the plastic surgeon, he says that there's so many instances where he's doing repair work. I don't know if that's the right word. I don't want to be disrespectful, but for women that think, "Well, I don't need it, it's fine, I'm this age," or "That doesn't matter to me." And then at some point, it seems to
They
maybe
changed
get
their
to
mind.
some of them, not all of them, and then they're coming in to see what options that they have. And I really think that the process I went through, again, I try to be careful of my words because I don't want to be disrespectful, but I found it to be much less traumatic, right? Because I can't imagine the feeling of, people who have it a different way. If they want it that way and they love it and they show it, beautiful. I love that. Own it. But for those who are like, I don't feel whole, or whatever their words might be, I just want them to be able to see what's there.
It's fun and kind of funny. When I envisioned this interview, I first thought about taking the viewer through all of the pain, the multiple near-death experiences you had, and then emerging with this part of the story. But we got ahead of ourselves, and I
Sorry.
think it's fine, and it's funny because people can now go back and look at this and see that there is life after the diagnosis. So very,
Yes.
very apt name.
Well,
Yes.
it's actually life beyond the diagnosis. So
Oops,
we're
excuse
talking
me.
about Stephanie's new YouTube channel for you to go ahead and check it out. I'm just listening over here, but I'm really both kind of impressed and puzzled by the amount of stuff we're discussing, because Dr. Brewer and I are guys, doctors that follow science, and we love to do that. Going back first to the EMF, you were saying, okay, this is something that probably caused that. If you go ahead and Google on the research, most people, even the American Academy of Cancer or American Society of Cancer, is going to say it seems like there's not a strong link. But how many people are exposed to that actually make that connection? Like at the beginning, you get the diagnosis, you don't really think about your cell phone being one of those risk factors. We talk about diet, we talk about exercise all the time. You mentioned stress, which is a little bit more acknowledged, lack of sleep, or even people who work on the night shift might have some increase in some studies, specifically for breast cancer as well. And now you go back to the phone, and you were sharing with us. Uh, you were kind of providing a quiz about what are the two most common types of cancer in men lately, on the recent years, that are uprising on incidence. It's prostate and colon cancer. And you were making that point, which I really loved, on where do men put their phones on? It might be on your front pocket or in your back pocket. So can we say, is that the only cause of cancer? Probably not, but of course, for some people, they might become a bigger risk factor than for others. So I really appreciate you sharing light on that situation, because we talked about diet and exercise all the time. That's absolutely one of the key items. But we sometimes neglect some of these other factors like stress or EMF.
Yes, I agree. And also, I feel like that too many times everything's about fear mongering. I am the opposite of fear mongering. And I just don't feel like that's, oh, I don't know the word that I'm looking for, but like positive, right? To just constantly put fear into people about all these different things. Let's uplift people. Let's educate people. Let's make them more aware of these different things to consider, right? There's such a large number of things. And part of the fear mongering is they like to say genetics, genetics, genetics. And I have to pick my conversation sometimes, because sometimes it gets to be a little bit much. But when people say things like, well, it's just in the genes, you're just going to get it. And I'm like, okay, don't pull at your hair. So that's not exactly true, because a lot of the cancers and chronic disease are about 10 to 15% caused by genetics. The rest is environment. And I don't mean like environment of like your house where you live. Yes, that's part of it, right? But your environment in your mind, your environment in your body, whether it's anger or whether it's fear, whether you're exercising, whether you're not, whether you're hydrating, whether you're not, right? Whether you have the chronic stress, what are you doing with the cell phones? And there's just a long list of these things that all are impacts. And I just don't want people to feel like they don't have control. And I don't even like that word either, but I want them to feel empowered, right? Like, I don't want people to think, oh, well, it's just in the genes. And so let's just, there's nothing I can do. It's just in the genes. Please don't have that thought, because it's so inaccurate.
Dr. Brew has
Well,
a
there's
saying for that.
What's that?
You do have a saying for that.
For what?
What Stephanie just said about lifestyle and genetics.
What is it?
Oh man, you don't remember even your own sayings now?
I'm having a senior moment. No,
So
you're talking about
okay, you remember now.
genetics loads the gun, but lifestyle pulls the trigger.
Exactly, 100%. I mean, they've been studying and talking about epigenetics since the 70s, but no one's really talking about that, right? But that's the kind of stuff. And that's when my doctor said, you've been preparing for this your whole life. I left out a piece to that. For 20, 25 years now, people would read stories, right? And they would watch movies and things like that. What I would do for fun is read books on epigenetics or neuroscience or biology.
Really?
Yes. Cancer causes, cancer cures, different modalities of healing, and just a number of these things like that, stem cell research, right? And that was what I would do, still do, for fun. Like, I geek out. I literally have ordered all my medical records, and I look at all of them, and I think it's the coolest thing of like, we took this piece of her body off and put it on the sterile table. And I'm like, this is amazing. Is there like a video I could watch, But so those things are, and juicing and the benefits of that, and pH balance and the benefits of that, and alkalinity, different things like that. And so I took all of those things that I had been studying all that time. And when she said that, I said, I do know what to do. I do know what to do. And so I worked with the medical team, and I put a complete protocol together of what to do for my treatment. And I learned something that I didn't really realize before that. I always thought I would never have chemo, I would never have radiation. And I still believe that there's not a place for that in every instance. Could be places for that, and there may not be places for that. But I never thought that I would have that. I always thought that I would take, let's say, the holistic approach. You could, under that umbrella would be like integrative medicine, functional medicine, things like that. And what I realized is I could choose more than one direction. So I married the standard of care with all these different things. And I went from that diagnosis of aggressive, invasive, triple negative, lymph involved, rare, stage 3 breast cancer to cancer free in 90 days. No evidence of disease anywhere. That's before I had a mastectomy.
So Jesus gets mad at me. Sometimes I'll go look something up while we're talking. And I have to tell you, I started to look this up. I couldn't help it. I thought about
Okay.
17 people had seen my videos on the methylome epigenetics. And I was going to ask if you were one of them, but we had more than that.
That's good. That's really good. I had not seen that one of your videos, so I have not. I've read a few books on epigenetics, and I follow a couple of scientists and their publications and things. I actually, all those years, right, I subscribed to Nature magazine. Are you familiar with that one?
Oh, yeah. That's one of the
Okay.
top journals in our space.
Yes, like that's what I would read. People have like they read the storybook. I'm reading Nature magazine. Like, and I love that, right? Subscribe to Orthomolecular magazine, like a medicine magazine. And then I was able to take those things and I realized like I was being prepared for this because why else would I like love all these things and then suddenly I need to apply all these things, or I could choose to not have, right? But I chose to apply all these things. And then everyone called me an outlier. All the different medical teams, you're an outlier. I'm like, but most of us can be outliers. They just need the information.
Well, speaking of outlier, we've only touched on parts of your story. You've got a whole bunch of bad stuff that you went through. Tell us a little bit more about that, ranging from uh, almost dying from a fatal complication to the actual original diagnosis itself. Where do you start
Yes.
that story?
That's a really good question. I guess I could start with the dying almost 6 times, or about 6 times. I like to include that it wasn't cancer that almost killed me 6 times. It was a rare side effect. It was called immunotherapy toxicity. And from that side effect, I almost died about 6 times before they realized like what was happening and what the situation was so that we could figure out some type of solution in the meantime to keep me alive, basically. And even though I say that, I'm not completely against immunotherapy. I think it has so many amazing places, and I think the idea behind immunotherapy is amazing. And when I was diagnosed, so funny, the cosmic jokes, right? I was like, well, no matter what I'm doing immunotherapy, and then that almost killed me 6 times. But that's okay because when I talk about that, it's not to instill fear in anyone that's considering it, got it, getting it. It's to share and educate so that if maybe they have some of those side effects, maybe it could be caught quicker and avoid them to have to go through what I went through and what my poor husband went through. I mean, can you imagine how many times he was like, and this is the day. This is the day where he died, where she dies. Okay, this is it. She's died, you know? And I mean, that's horrible. I think it was worse for him than it was for me.
Well, speaking of which, that gets to one of the questions I wanted to ask, and this may be the best time to deal with it. Our channel is uh, at this point still it's an older channel because I'm an old guy and I deal with a lot of my own personal medical issues.
You
So
have
it's
been
people
doing
that
this
have
channel for a while unsuccessfully. That's what you mean when you say an old channel.
every time Jesus tries to bring in younger folks, that's old boomers uh, get in the way and crush it. So one of the things that I wanted to ask is, what advice do you have for, well, let me finish that. So it's about 75% men and 50% 55 and older. So it's clearly men in this category, this risk area. Yours was much, much younger, but you've come through the worst and you've come out on the other end with a great attitude and a great story. What kind of advice do you have for men watching this video?
If I'm to assume that the men watching the video could be watching it because maybe their loved one has been diagnosed with breast cancer, whether it be now or 6 years ago, actively in treatment, any of the things. I think that, well, part of my mission, right, is to educate anyone affected by breast cancer, not just the women. And my advice to the men, which I know that there's a chance that men could have breast cancer as well, it's not a super high percentage, right? So when I address men, I'm thinking that I'm talking about your loved one's been affected. And I'm going to say the number one thing is if you could possibly help with mindset in any way of your loved one, it's going to be huge, right? And I'm not saying that that's going to be an easy feat because you can have moments, right? But we just can't stay in those dark negative moments. So whether it be just giving them a positive quote each day or finding great meditations and sharing that with her, or whether it be just, you come home and it's like, hey, what were 3 things great about your day today? What are 3 things you're looking forward to tomorrow? Because I feel like there's multiple pillars of success, one being mindset. You have to believe that you can survive. You have to believe that you're going to be okay. And so I think that if our loved ones could support us in that, right? And even if we're like saying something insane, if it's positive, who freaking cares? And just like, yes, that's great. That's great. Just kind of keep us in that really positive mindset. And you can do things like that, like I said, like asking great questions. Maybe if you're having breakfast or dinner, lunch together, like what are 5 things we're grateful for? And then focus on gratitude. Like I said, sharing meditations, sharing positive quotes, things like that. And then not projecting forward, because one thing that I would like to share with the women, I know we're talking about the men, maybe the men could help with this, is those like projection of forward. So one of my things is I've always had this vision of myself being a 105-year-old lady running a marathon wearing a red tutu. And that vision helped me it helped me, right? Because I'm like, well, I don't know. Well, not me, not today. I'm going to be that lady that's wearing the dang red tutu, running the marathon, and having a good time doing it. And
Now,
so, okay.
is that the tutu that you wore to your chemo?
Oh, I have so many tutus. I have a whole other story about the tutu if you want to sidestep for that.
I'm sorry, I interrupted. Go ahead.
That's okay. Tutu stories. So I take my niece a few years ago. She's probably about 8 years old to this race, right? And we get there and she's like, oh my gosh, everybody's wearing tutus and I don't have a tutu. I'm like, I got you. Pop the trunk. So you have tutus in your trunk? I have several tutus in the trunk. Who doesn't keep tutus in their trunk? There's always a moment to dress up, But I digress. So I think one thing would be really just helping in any way possible on that mindset. And if they say, I am going to stand on my head for 2 seconds every day because that's going to make me heal and that's what I believe, then hold their dang feet and let them do it.
That's a really good advice. I think, men are different from women. We're different creatures. And like so many people have said, men want to solve the problem. Well,
yes, I'm sorry. I'm so sorry.
Don't do that.
No, that's not what I was going to say. But the thing is I was thinking about this yesterday and I wanted to put something together on it. There are many times, that's a huge piece of advice, because there are many times that all we want to do is cry or scream or just go through those moments. And we don't want you, well, sometimes we do, but most of the time, we don't want you to solve the problem. We just need you to listen. I remember one time, try not to cry, but I remember one time, and this was kind of after a lot happened, and I am just hysterical. I mean, I'm like hysterical. Like friends had to come over and just like my husband was trying to get home and just horribly hysterical. And he gets home and he's like, I mean, he doesn't even know what to do because he's never seen me like this. And I just remember saying, sometimes I just have to go through it to get to the other end. I have to go through. I can't go around. And so I think if they could maybe realize that, right? I'm not asking for you to get anything or do anything or nothing. Just sit there and just like validate the feelings. You know, like I understand why you're mad. That makes total sense. I understand why you're sad, you're angry, whatever that emotion is, but just kind of validate those feelings and just listen. We're not always looking for the fix or the solution. And that's something on the opposite end, you know, having loved ones going through it before I did, because I'm a fixer too. And that was hard for me to learn as well. Like, I know that's not, let's not fix it. Let's just try to support and listen and uplift through that moment, through that process of emotions.
As a man, that speaks to me because, you know, I often dupe myself into thinking that I'm self-aware. I'm not. I'm just not. And Jesus can tell you that. I'm sure he will if I give him a chance. But
You never listen. You never listen. I can't even imagine how are your relationships now. That just it's hard for a man to digest that. And
yeah.
you
Can you
probably
imagine?
gave the best piece of advice for any man out there. I can imagine now, or the viewer audience, if you're with your wife right now on the couch sitting there, or laying down in bed just having your breakfast and watching the TV, listening to Stephanie. If you're getting one thing out of this talk, at least get that, because if you listen, everything's going to be easier.
And if you're not sure, then pause, rewind, rewatch like 10 times till you get it. And all the women are going to be like, thank you, thank you.
Yeah, I know it doesn't seem to make sense, but it does. It clearly does. A lot of marriages can be saved just by listening, especially on problems like this. Like, you really, I mean, as a man, you want to support your wife. You want your wife to be with you. You don't want her to die. You're gonna look everywhere, below every rock, to see if there is a solution that you can use. And at the beginning, or in plenty of the stages of that process, which is not easy, is just be there and support.
You just want to fix it. You got to stop that, give that up, and just be there.
Yeah.
Yes.
All right. So, I don't know if I stole your thunder, Dr. Brewer. I won't apologize for that either. What else did you do, Stephanie? Something else that you did to overcome the challenge? Because I think people are going to be interested in that as well. All right, you get the diagnosis, you go into the medical professionals, you try different sets of treatments. Was there something else that you tried that you think helped somehow?
One thing, so I say different pillars, right? One pillar being mindset, another pillar being hydration. And this is something that I may argue with some oncologists about, but not all of them, because some of them get it. Hydration. And you are both doctors, so you can completely speak to this, right? I like to use the analogy of your car when it comes to your body. Okay. If you keep everything up, all your fluids, right? Then most likely the car is going to go pretty far. I mean, take away tires and stuff like that, right? But the engine per se. And if you don't refill the oil or the power steering fluid or the brake fluid, what's going to happen? Something, a component is going to break down, and one component can affect the entire engine, right? So with hydration, one of the components, I mean, because we're made up of so much water, is being hydrated enough to help your body heal more successfully. And when I was speaking, so I interviewed 3 oncologists. I went with the third one. I am still love her so much. So glad that I did. The first one, my husband was concerned when he saw my face, because this guy was like never going to work with me. The second one, she was really nice. But the third one, we kind of really clicked. And I said, I have a question, because I had female surgeries before. And I figured out that the anesthesia would sometimes stay and affect me for like 2 weeks after a surgery. So I came up with a protocol for pre-op and post-op. And this was before breast cancer. I said, Dr. Larned, when that happens and I'm having anesthesia, I know that as soon as the drip stops, the anesthesia's done its job and I can move on to detoxifying that from my body. Like it doesn't have to hang out there. And she said, yes. I said, so tell me about chemotherapy. Does it have to hang out there? Or like once the drip is done, can I start detoxing? And she said, that's a fantastic question. No one's asked me. You can actually start detoxing from it. I said, okay, well, then the first thing I want to do is I want saline dripped directly after the chemo infusion. That way, now saline on its own, right? Not the saline that's in the bag with the drugs. That would be like saying iced tea is water, which it is not, right? So I said, can I have a bag of hydration after every single drip immediately so that I can start detoxifying from it, but also allow my body to be in a better position to be able to heal? Not to mention that it seems to me like many side effects from chemotherapy can be correlated to lack of hydration, aka dehydration, which has so many side effects, including death, by the way. And so if we could do the saline after each and every drip, then that's going to avoid so many of the negative side effects and be part of my detoxification process. And she agreed to that. And I have shared that with many women, and the feedback has been incredible. One woman said, I am so grateful for getting this information because the first two chemos, and also people may not know, chemo is cumulative, right? So I don't want it to build up and get worse and worse and worse. I want to detox with each drip that they're giving. And so she said, this time I came home, I played games with my kids, we had dinner together. She's like, I cannot express to you, the difference is unbelievable. And that was just from one of the hydration drips. And then she was able to get more thereafter, but the feedback has been incredible. And I would imagine that it would be.
Very interesting. How about electrolytes? Any issues there?
As far as lack thereof.
Mm-hmm. During
With
her chemo, did you have, what was the chemo like? I know you gained 40 pounds.
Which
That's the opposite of what most people expect for chemo.
Okay, this is a really funny little joke. So my friend was going through the same rare breast cancer like a year before me, and she called me one day. She's like, what the heck happened when people would lose weight on chemo? Because we both were gaining a bunch of weight, right? Well, I think a lot of my weight was from fluid retention, but I was fine with that. I was fine with that over what the opposite could have been. And so, but in addition to that, I'm going to go back to the engine analogy where I wanted to fuel my body, aka the gas. I wanted to fuel my body as good as possible to be focusing on the mission, right? And that was ratifying the cancer. And so I ate probably more than I've ever eaten in my life. I remember overhearing my husband say to someone, it's so weird. Like I'm sitting here watching her eat like a man. She's never eaten like that. But I mean, I fueled like crazy. And so that was another thing that contributed to the weight gain as well. But with electrolytes, I did not have an issue because I was supplementing the electrolytes.
Very good.
And that's another thing too, is so many women go in to get chemo and they test your blood before you go in, right? So many people are sent home because their blood work is not, I don't know what word, not normal, optimal, I don't know, acceptable, shall I say. I never once missed chemo from the blood work not being optimal, but we've touched on a couple of things that I've done, but I did several things. And that was another indicator that things were working, because I never needed the injections to increase my blood cell count. And I never missed the chemotherapy because of blood work issues.
Well, Stephanie, I still find myself sitting here thinking you went through some of the worst of the worst, but none of that's coming out in this interview.
Oh, well,
And I'm not saying that's bad. I'm just saying, I don't think people are going to understand what you went through.
I know. Well, the thing is I am so optimistic. And a friend told me that when it comes to, like, when I got the receptor blood work part of the diagnosis, right? I just, again, had a big meltdown, because I knew about these things, right? Because I've been studying this stuff for fun. And so she's like, go ahead.
Don't assume that our folks do. Tell us what that means.
Okay. When you have a breast cancer diagnosis, there are multiple things that go into that. One of them being the hormone receptors. And I had all negative hormone receptors, which means that the breast cancer was not fed by hormones. We can pause on the whole hormone and then hormone blockers later, because I have such mixed feelings on that, because the whole estrogen thing. But so when they were saying negative, I was like, so you're telling me I'm triple negative? And I just completely had a meltdown. So my friend happened to be there at that time. And she said that she just saw me just go through this like crazy meltdown, but then process it really quickly, which is another thing I'm really lucky, is that I can process things real quickly and flip it. And then she's like, and then you just flipped it, and then like you were like falling on the floor, and then you just went through the process, allowed yourself through that process, and then you were like, okay, so all right, this is the thing. So when that diagnosis, that part of the diagnosis happened, me being able to really optimistically flip things, I was like, okay, well, the good part about this is that that is supposedly the one that is the most receptive, or one of the most receptive and successful with chemotherapy. So I was able to kind of flip that, right? And
so it maybe wouldn't work with hormonal treatment, but maybe it'd work with something else.
Right, like it may not have as
You're
much
given
effectiveness.
lemon, so you made lemonade.
Oh yes, and so I do that all the time, and I think too that was really important, because I'm learning things like as the time goes on, right? The other thing is I have a podcast, and through everything I went through, I recorded live on the podcast. So as I had a diagnosis, I recorded live. As I got receptors, I recorded live. I had my first chemo, I recorded live. And so I have all that to go back and listen to, which I've listened to a little bit. The point is, I had no idea how therapeutic that was, because I was getting information, and then I was trying to process information, and then I'm processing it verbally as I'm explaining it to people listening to the podcast. And it was just unbelievably therapeutic. And so being able to just flip different things. I mean, with the mastectomy, right? Which at first I was like, I don't want a mastectomy, and I don't want chemo, and I don't want all these things. But I had always had large breasts, and my mom, my child, like large breasts for small, small frame. I was like, okay, well, this is great. I'm going to get brand new breasts, and they're going to be smaller, and I get to pick the size. Like, who gets to do that, And so just kind of different things like that along the way of finding the positive. And even with like chemo, when I decided to do chemo, I was like, if I'm going to do this, I'm going to have a damn good time doing it. And I went out and I bought costumes for every single treatment. And I filled that chemo place with glitter everywhere and gigantic wigs that would like, one of the wigs would hit the corners of the wall as I would walk by, because it was so big. I kept like hitting the wall and stuff. But it helped because of the mornings when I woke up and I said, I'm not doing this. I'm not going today. I'm not participating in this anymore. No, thank you. And then I would just kind of talk myself through it, like, just get dressed. And then I would get dressed and then I would look in the mirror and I looked so ridiculous, so ridiculous. And then I would just laugh at myself and I would say, all right, fine, I'll go. And a lot of these outfits were purchased off of Amazon. And why did the children get all the cute clothes, by the way? So I would buy children's outfits. So as I would walk the front, it would look like this, princess dress. If I turned around the back, it wasn't all the way zipped because it didn't fit. But I was like, whatever, I'll just walk forward into everything. I don't know. Like, I want to be a unicorn today, and that's what I'm going to do. So I hope that the fact that I'm not completely traumatized, it will show people that, again, there is life beyond the diagnosis and that there is hope. Like, you can reach for something, right? You can reach for some type of hope. You can reach for something optimistic in that day. If the only thing that's optimistic is that you woke up, I don't know, or you had water to drink. Even the simplest of things, just finding joy and happiness and laughter in the simplest of things and talking about what you're going through, processing it just comes such a long way because I'm not, again, I'm not years in and still processing a lot. I even went to EMDR therapy recently. And I've been through a lot of trauma in my life, so don't think not. But she was like, okay, well, we had 5 or 6 sessions, and she's like, you just I don't think you need this. I'm like, well, what do you mean? She's like, well, you're not like traumatized by something. I'm like, well, I've had all this trauma. She's like, okay, I know, but you're not traumatized by it. It's like I just talk myself out of things. I don't want people to take that wrong because I'm not not associating. I'm not in denial. Processing things, I'm just picking anything positive that I can find out of it and using that as like a glimmer of light to kind of move toward. Is that a long enough answer?
It's a good answer. You
Sorry.
dropped the word EMDR.
Mm-hmm.
You want to explain that? And then I'm going to ask you to explain adrenal insufficiency.
Okay. EMDR, I don't know the name, like what the abbreviation means, but it's a type of trauma therapy. And I believe that the way that it works is it's basically creating a pattern interrupt in your neural pathways to, like, let's say if I'm getting, I don't know, if I'm picking up this fan, right? And something happened in my life and fans are a trigger and they traumatize me, right? Well, through different things, like it could be music or it could be like these flashing lights. I think there's 4 or 5 ways. And it just kind of like takes your brain and just like tricks it, and not trick, but pattern interrupts that pattern. So then that trauma becomes less of a trigger. Does that make sense?
Yeah, we talk about science a lot, and I love to make stuff up, or at least I love to go back and say what I remember. And what I remember, I've had EMD, and what I remember from reading about it was there were basically 2 things in mental health that had good numbers. One was CBD, not cannabinoids, but cognitive behavioral
therapy.
And the other one was EMDR. And again, it's more of that pattern connect. You go as close as you can to reliving something, and then meanwhile you're constantly getting interrupted, and so
it stands for eye movement desensitization. Easy for me to say, and reprocessing.
Yeah.
Just so for the geeks out there that are curious about it.
So, adrenal insufficiency. Tell us about your story on that.
After chemo and immunotherapy, without completing the full process of what was planned for immunotherapy, it was around August of 2021, and I got permission from my oncologist to go on a wellness retreat. I'm used to traveling a lot, and I'll even go by myself, and I love to travel. And I was really like, again, like something to look forward to, right? I was looking forward to this I was going to go on this trip and I was going to go on this retreat. And so I get there, everything's seemingly going fine. I get to the hotel room and I immediately started feeling very sick. Lots of throwing up, going to the bathroom, just feeling so exhausted and lethargic. It took everything I could to go to some of these different little, I guess, appointments, if you will. I don't know, different things. But, and luckily, my friends and family were so in tune to me. And there came a point, this was only over a few days, but where I couldn't even like get out of the bed. I couldn't even talk much. I couldn't do much of anything. My loved ones were calling the hotel, and as I'm sure you know, you can't just call a hotel and say, hey, go into so-and-so's room, right? So they were just calling, and they were finally like, if you don't go in this room, she might die in there. Like, she's not responding. She should be answering. You've got to go in this room. And so they go in and they take me to an emergency room. I don't remember a lot of things because one of the things, aside from nausea, vomiting, diarrhea, is loss of consciousness and lowering of blood pressure. There's a few more I'm forgetting at the moment. So I don't remember a lot of that first ER visit. What I do remember, and I will never forget, is that I am in the hospital, in the like on the gurney, right? And I'm laying there, I'm holding on to the rails, and I'm saying, and I remember a female, and I remember saying, you can't you can't make me leave. Something's wrong. You can't make me leave. And I remember her saying, ma'am, there are people waiting for this bed. I think she thought I was a drug addict or something because they couldn't find anything wrong. And they made me leave. I have no idea in the world how I walked out of that hospital. I have no idea how I got to the hotel. I have no idea how I got to my hotel room, who put me in my hotel room. Like, I mean, I could have been, so many bad things could have happened because I was completely vulnerable by being kicked out when I was dying. And then I remember the next day waking up and there being paramedics and firemen all around the bed. So apparently my family got them to break in the room twice. I remember hardly nothing, but I do remember being somehow managing to say, don't take me to this hospital because they just kicked me out. And so they rerouted to a different emergency room. And I don't remember a lot of details about that emergency room either, or how I got to the hotel, like any of the things. No memory. I'm back at the hotel again because that's, I guess, the second hospital that has kicked me out when I'm literally dying. And somehow my husband, he's like, I'm coming to get you. Like, I'm flying there, I'm coming to get you. And I vaguely remember like being able to get up and just start packing everything. And then I remember being at the airport, not how I got there, but the airport. And the plan was he was going to get off of this plane, and then literally it was the same gate that we were going to, get together and then get onto the other plane. And we had like an hour window, like it was going to be this perfect alignment, or so we thought. He shows up, he has nothing but what he's wearing because he thinks I'm just going to be 5 minutes and I'm going to grab her and we're going to, go back home. He gets there and I'm laying on the floor of the airport. And right about the same time, I just start vomiting everywhere. And it was like, I guess it was bile at that point. It was just brown. And I remember him like going to, I guess, a worker maybe, and, grabbing paper towels and stuff, and people calling 911. They had to clear the tarmac to then come get me again in an ambulance. And we ended up being in that hospital for over a week, and they were doing all that they could, but they still couldn't figure out what was wrong with me. And then we managed to navigate and get home. Again, I don't I just don't even understand. And I try not to ask too many questions because he's still very, very, very traumatized by this. And so I have to, be very careful about how to ask and things like that, or when to ask. There's a lot I haven't been able to ask, but we end up at a hospital here and they're another week and they did so many tests. I remember a lot of that hospital. And then they send me home and we still don't know what's wrong. And this happened several times, to where the last time that the ambulance picked me up from home, my blood pressure was 40/20. And that's why I couldn't move, because I kept telling my husband, you don't understand. I can't get down the steps. I cannot get into your truck. Like, you've got to
Repeat that
call
blood pressure.
911.
Repeat that blood pressure again.
40/20.
Hmm.
Insane. And that's why I couldn't do anything, because it's like,
Couldn't get in the truck. You couldn't do anything.
no. And then I remember being in that hospital, and I remember the nurse doing something with the IV. And I remember going, did you just give me steroids? And she said, yeah, I just put steroids in the back. And I'm like, I feel that. Like, I feel like my body coming to life. Like, what? And this is not making any sense, but and so it turns out what was happening with the immunotherapy toxicity, my pituitary test fine, my adrenals test fine, but there's a disconnect in the communication between the two. Therefore, at the moment and back then, my body's not producing any cortisol. A lot of people think that cortisol is just a stress hormone, but cortisol is a life hormone. You have to have cortisol to live. It also controls sleep-wake cycles and a multitude of other things. And once we started putting the association with the steroids and everything together, that's when we kind of realized what was happening. And so I'm having to, even at this point, I will not say that it's forever. I do not believe that. I'm still having to take steroids every single day to not die. And it's difficult. It's very difficult, because that roller coaster sucks. Because I just recently switched medicines, which I'm trying a new medicine now, but I would have to stop and take a nap in the middle of the day for nothing, like even with the steroids. And then I would have to go to sleep early, or sometimes sleep 14 hours. Because when your body, when you're going through physical or mental or emotional stressors, your body's going to uptick that cortisol to kind of catch up. I'm having to figure out, oh, wait, I should take a extra steroid. I should updose because I'm busy today, or I should updose because I'm having stressors today, or and this manual thing, which sucks because I've crashed on vacations even since then. It had to be emergency injected and everything else. So it's this really crappy situation to be in, and it's called secondary adrenal insufficiency, which does have a potential to heal. So that's not fun.
It doesn't sound like it's fun, but you sound like you're very hard-headed about dealing with this in a good way.
I'm hard-headed about everything.
I had a little bit of an inkling.
I just feel like it's my body, it's my life, it's my situation, it's my decision. And that's what I also want survivors to know, is to be empowered. Like, people can tell us, what the suggestions are, and we should get more suggestions. And then we should double check them, and then we should make an educated decision.
Most of our world is cardiovascular disease until Jesus is successful at changing that. And we have a lot of patients that have fired their doctors. It was interesting to hear you say you interviewed 3, was it oncologists before you selected one? Great
Yes.
advice.
Yes, because each of them had a different plan or protocol or treatment for what was going on. Each of them did. And then I researched that and double checked that. And then ultimately, as a combination or effort between the two of us, that's where the plan emerged. It wasn't the first doctor or the second doctor or the third doctor. It was taking all the things that they said and then double checking all of that and then coming back together and then making a decision on the treatment plan.
Very interesting story. Is there anything that I should have asked that we haven't?
Hmm. Maybe. Well, some of the other pillars of success that I talk about besides the mindset and besides hydration is rest and recover. Because many women, we try to push through everything. We try to push through feeling bad. We've got to feed the child. We've got to cook the dinner. And some people don't even do that, but just whatever applies, right? We've got to show up for this person. We've got to show up for that person. We've got to make these appointments. We've got to attend all these things. And we put ourselves second. And we think we need 2 days to recover. Well, then give yourself 4. We think we need 2 weeks to recover. Then give yourself 4, give yourself 6. Like, give yourself the extra time to rest and recover. As much as I know and I have researched, I'm still really surprised at the fact of how long my body was actually still healing and therefore a little bit inflamed because I had lost all the chemo weight, right? But even for so many months after that, my body was still changing and shifting and recovering from all the trauma. I mean, I thought it like 3 different times. Okay, now I can go pick the bra size. Now I can go, now I know I'm this size. And it's not. It keeps, changing. Now I think I am, but that's months and months and months later than I thought that it would be. So I think that rest and recovery is just crucial. What are your thoughts on that before I go to the next piece?
Oh, there are a couple of things. Lack of sleep is likely to be the new smoking.
Yes.
It was 20, 30 years ago, we didn't even recognize smoking was such a problem. We're just now getting our head wrapped around lack of sleep and rest.
Yeah, because it's our body's reset. Like if we don't get that rest every night, your body's just going and going and going without the full reset. So I think that the rest and recovery is a huge piece. And nutrition is another piece of that, whether it be juicing, which I love people like to fearmonger and say, don't juice, you're not getting the fiber. Well, how about we juice and we do some smoothies to get the fiber, right? And we eat the physical fruits and vegetables to get the fiber. So it's things like supplementation, juicing, nutrient dense meals. And then the other piece would be detoxification, right? So for detoxifying the chemo, I did the hydration, which is a piece of that. But I also did acupuncture and I also did colonics and I also did vitamin drips and I also did supplements and I also did ion foot detox baths and I also did clay detox baths. And I like to share this story about the ion foot detox bath, who a lot of people like to say, oh, there's no science behind that. Well, this was very interesting. I had been doing these foot baths for years, so I knew the progression of what they could look like depending upon what my body's going through. And my husband's always been like, kind of, it doesn't really work, whatever, but support whatever you want to do. So I did my first detox after chemo, the first ion detox bath after chemo. And I'm just doing my thing, reading and it's, doing the foot bath and all that. And I finished and I turned the machine off and I was like, and remember, I'm up here and my feet are down there, right? And I'm like, what is that smell? And so I've been down, I'm like, oh my God. So not only is this water, which has never in many years ever been black tar sludge that smelled like a battery, crazy, crazy metal smell. And so I got, rinsed off and I went to the living room because my husband helped to research the chemotherapy drugs. And I went and I said, hey, is there metal in chemo? And he's like, yes, absolutely. There's this, and this. And I was like, come see for a second. He's 6'2". I said, don't bend down. Just stand up next to this thing and just tell me what you smell. He's like, metal. I said, now look at this. Now look at the little machine that tells you what the colors and the flakes are. I'm like, don't you ever tell me again that this does not work, because this is mind blowing and just unbelievable, unbelievable. And that's part of my detox process as well.
Very interesting.
So
Jesus, you got anything else before we go?
I was just about to say that. I'm sorry to be the person who says it, because I'm loving this conversation. We're just touching on a lot of stuff we don't usually do. And I'll be happy. I think we both will be happy to have Steph coming back again on another day to talk us a little bit more about maybe the supplements she used, maybe a little bit more of the lifestyle that she's following. Because people need to hear this. If you were to ask me, hey, what about cell phones causing cancer, or this part of the detox? I'll probably say, well, the evidence says it doesn't. And then you have outliers, as Stephanie said. And you need to hear the stories to really know and put into perspective that even science has there are mistakes in there. It's not like what you see on a published paper applies to everybody.
It's an interesting. Go ahead.
No, yeah, that's it.
It's an interesting thing about that, Stephanie and Jesus. Stephanie, you may not know this. We're a low carb channel. Our goal is to help the 80% of people 60 and older that have diabetes or prediabetes and don't know it, find it. 90% that have it don't know it. And when you get younger, 18 and above, over half of us have prediabetes and don't know it. And it's a setup for cancers as well as heart attack, stroke, blindness, a few other things. So we end up getting stuck on that topic a lot because there's a lot to it. And we don't get into a lot of other things. And I got a personal reminder, gosh, it was a year or two ago. I had gotten some grilled broccoli spears. Was it broccoli? No, it was asparagus. And I had brought them home in this little plastic doggy bag thing, and I was heating them the next day in the microwave, and somebody with me just wore me out about that. And I said, you know what? I deal with diabetes. That's going to kill you. I'll take my risks on all the other stuff. And sure enough, a few months later, I was looking at my space, and then they start talking about some people in Italy finding microplastics in artery plaque. And it's like, be careful. Think about these things that we call zebras in medical school. They say it's a zebra because if you hear hoofbeats outside here in the US and you think horses, you don't think zebras. That's just not going to happen. Well, be careful making that assumption. Unusual things happen and people have to deal with them. And you had to deal with a couple of really unusual things. You dealt with them in a very unusual way. Thank you for telling your story.
Thank you.
I think a lot of people can learn from that.
Remember to go ahead and visit Stephanie's new channel, Life Beyond the Diagnosis, on YouTube. It's a small channel right now, but we're sure that when it reaches the people it needs to reach, those people who need to watch that story, it can be your wife, it can be your daughter, it can be another relative or friend of yours. make sure to let them know that exists, because it's full of experiences and good advice for people dealing with this problem.
And if you're a dumb old man like me and you always want to solve things, you might want to watch this.
Yeah.
Thank you so much, Stephanie.
Thank you.